We're back with nurse practitioner Jolene Cannady with Cone Health Crissman family. She's here talking about all the ways to keep us healthy this fall. The state actually just saw its first flu death of the year last week out in western North Carolina. What kind of flu year are you expecting?
That's always a tricky question. I expect to see a little bit more flu this year, depending, of course, on how many people get vaccinated and how people are protecting themselves during the season.
Vaccinations, that's the key for flu, COVID, and RSV. Who should be considering those?
So the COVID vaccine, that one's getting tricky. So right now they strongly advise it for adults 65 years and older. It is recommended for those 19 to age 64, but they say to discuss it with your provider first, especially if you're immunocompromised or if you have a chronic health issue. And then children 6 months and older, they say to discuss those vaccinations with a healthcare provider, and we do have those available at Cone Health. Flu vaccine is recommended annually for everyone 6 months and older, especially older adults, pregnant women, younger children, and people with certain health conditions, just to keep them safe during the season. And then RSV, that is a single dose. So the CDC recommends it for pregnant women during weeks 32 through 36 of pregnancy to protect their baby from severe RSV disease. And then adults ages 75 and older and adults ages 50 to 74 at increased risk of severe RSV.
Can you just go and knock all these out at one time, or is it best to space them out?
So I will be honest, I did get my COVID and flu at the same time. You can do it. You might feel pretty bad. So I do tell my patients, sometimes it's good to separate them just so you don't have some of the side effects joined together.
Okay, besides the vaccines, are there any steps we can take to lower our risk of getting sick?
So trying to avoid exposure is a big one. So if you know somebody in your family is sick, trying to limit your time around them. And then just being cautious when you're out and about. So washing your hands is a really important way of prevention. And then just covering your mouth, covering your nose if you're sneezing, coughing. Those are big ways to help prevent illness.
What are you predicting this fall is going to be some of the big challenges people might have when it comes to respiratory illnesses?
So things that I've seen patients so far this year, I noticed that they have worsening cough symptoms recently. And then, of course, vaccinations, I do see that kind of 50-50 in regards to who's getting vaccinated. So I think there'll be a little bit more of a higher flu season. Definitely some COVID is presenting again. So it's kind of just waiting and seeing which directions we're going.
Speaking of coughs, we've all had that one cough that just lingers and won't go away. When do you need to see someone about it?
So there's a really good access to conehealth.com/getcarenow. It's a great website to look at, and it even explains, different places you can go. So I think of it as mild, moderate, and severe. So virtual care I think of as mild symptoms. So those are those non-emergent symptoms such as the cough, runny nose, sore throat. If you don't want to leave your house, it's a great option. I've actually used it. It worked wonderfully. Urgent care is a great place to go if you're having more moderate symptoms. So if you're having a fever, wheezing when you're breathing, or if you want to be tested for flu or COVID, urgent care is a great place to go. And you can even schedule urgent care visits online, which I have done personally and works wonderfully. And then emergency care, I always save that for my severe symptoms. So I tell my patients that's where you go if you're having chest pain, severe shortness of breath. That's when you want to go seek immediate care.
Why is it so important to take these symptoms seriously and not just brush it off?
Well, because as we've seen, we had our first flu death this year. So, I always think to myself, flu and COVID, they seem like a simple viral illness, but simple viral illnesses can turn into major health issues if we don't keep an eye on ourselves.
Anything else you want people to know about staying healthy?
So my big things are always getting vaccinated. I'm a huge advocate for vaccinating. It's a great way of prevention, and just remembering that the vaccines are so easily accessible at many locations, including pharmacies, Cone Health, lots of different locations. Washing your hands, really, really important. So at least washing your hands for 20 seconds with good soap and water. If you sing happy birthday twice, you will get through a good hand washing. And then one thing I always think about is my mother always told me as a child to cover my mouth and nose if I'm coughing or sneezing. And so that really is a good way to prevent you from spreading to other patients or other people. And then just making sure you're getting lots of good water in daily, good sleep, and then getting a good nutritious meal. Those are things that help support your immune system.
A good mom there, teaching us all the right way to do it. Thank you so much for being here. We really appreciate it. All of this
You're
information
welcome.
and more will be up on WFMYnews2.com and the 2 Wants to Know section later if you want to share it with the people you love to keep them healthy as well.